Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. What tests do you require to analyze if you need fertility treatment? We'll begin with ovulation test. Ovulation is very important. It's the release of eggs from the ovaries, and this occurs every month, 15 days before your period. So to understand whether you are ovulating or not, the best thing is to do a LH kit test. It's a simple urine test where luteinizing hormone is tested by first urine of the morning. So if there are two lines on that kit, on that pregnancy kind of a test kit, it means that luteinizing hormone is rising and it means you're close to ovulation or you're ovulating. And next is basal body temperature increase. Around the time of ovulation, 0.5 to 1 degree centigrade rise in temperature is observed. So that is also another way. Scannings are also done sometimes, especially when you are undergoing treatment, to see if you have ovulated from the ovaries and which side have you ovulated from. So understanding ovulation is extremely critical, especially in people with PCOS or people with ovulatory disorders. Scanning can definitely help them see if they're ovulating or not. Next, we come to hormonal testing. Blood tests are conducted to find out what your follicle stimulating hormone levels are, luteinizing hormone, thyroid, prolactin, estrogen, progesterone. All these hormones are tested, and in addition to this, androgens are also tested. So all these hormones give us an idea whether the ovaries are receiving the right kind of hormones, they are acting under the right influence, and ovulation is happening regularly. So hormone levels are very important. Prolactin is also a very important hormone. If the levels are high, it means that you are not ovulating properly. It is usually released when a mother is breastfeeding. So this has to be checked, especially when you are wishing for pregnancy. Next comes tubal patency. To find out if your tubes are patent, if they are open, HSG or hysterosalpingogram is performed. It's a very simple test where dye is passed through the tubes, and if it spills on both sides of the tubes, it means that the tubes are open. So it's a patency test. It has to be done to find out if tubes are open. Next is semen analysis. Semen analysis is conducted on the partner's sperms to find out how the count motility morphology is, in addition to volume, pH, if there are blood cells, if there are white blood cells, if there is any kind of infection. All these are estimated to see if any male factor infertility is responsible for the overall infertility. So when we do all these tests, we also recommend some additional tests if everything has turned out normal. Maybe a genetic karyotyping will give us an idea about what the genetic makeup is of both the partners. In addition to this, a DFI test, which is DNA fragmentation index test performed on the sperms which are produced by the partner. So all these tests definitely give us an estimate of where the problems could lie or what treatment should be followed to help you achieve pregnancy. To understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.